AAR, celebrating 25 years of excellence. 4 years after arriving in Kenya, Bengt Beckman founded AAR, the first healthcare provider in East Africa.
He was passionate about private healthcare, and he wanted to make sure that it was a model that we are not going to talk about a third world model. It's a first world model.
It's a very small company with Bengt and Jerry Davis. Jerry Davis was the driving force behind the first 5 years.
I was operations manager. I was general factotum. I used to meet the aircraft. I used to go to Wilson Airport or Jomo Kenyatta Airport, and I used to meet the people and talk to the people. I used to fight the customs because they tell me you're not allowed to bring this man in. He comes from Somalia. I said, I don't care what your regulations are. This man is a sick man and he's going. Driver, take him to the hospital. And I was summoned the next morning by the big boss in the Wilson Airport that I was not allowed to just take charge. I said, well, you know, the man comes in late at night and he's critically ill. What do you think I'm going to do? Send him back to Somalia? No. I don't care how I treat people. If you don't treat people properly, then I will fight for them. And I did fight for them. And then I begged you to say, oh, go and sort them out, Jerry, go and sort them out.
The Kenyan people, however, were not ready for his dream. And in 1986, Beckman began to wonder whether his radical concept would be accepted by the Kenyan market.
He was living on the edge. Very much, and it was something obviously that he was incredibly proud of having set it up.
It transpired that actually it was a good idea, and many other HMOs sprang up, and it changed the whole concept of private healthcare. The insurance industry also realized that actually managed healthcare, as it came to be known or to be actually popular, was the way forward.
By 1986, AAR had exploded onto the Kenyan market, and in 1994, AAR Uganda was launched. The same year, Beckman moved to Poland and set up Medicover, which is now the leading healthcare provider in Central Europe. Meanwhile, AAR was growing rapidly in Kenya and Uganda, and in 1998, AAR expanded into Tanzania.
From little things, big things grow. From little things, big things grow. We all need a place of security.
We thrive on challenge and success and perform our activities with a high level of urgency. We believe in getting things done right the first time.
We anticipate, understand and focus on meeting the needs of our teams, our customers and partners. We like what we do. Our well-being is interlinked to the well-being of our customers. We care.
We take pride in what we do and deliver high-quality, value-added solutions.
We are trustworthy, diligent, and honest. We accept responsibility for our actions and follow through on promises and commitments.
If you really want to be a dry, cold business person, do not be in healthcare. Because it is a place where the reward of what you do comes from your emotional commitment in helping people.
And the key thing that AAR focuses on is recruiting the right kind of staff. We recruit people based on qualifications and merit, but we also look for a little bit extra, which is really whether they embrace or reflect the core values of AAR.
The secret here is that technology also drives down costs. It improves the sophistication and quality that you can actually give to members, and it drives down the cost. And that's the secret, because once you drive down the cost, it makes it more affordable.
Normally insurers provide insurance services, they sell products, but they don't provide services. So we see a lot of synergies arising from the fact that we are an insurance company and we're also a provider of services. And for Tanzania, that's extremely important.
To know how the business has evolved is critical, because how we started is very different from what we are today. I believe we continue to evolve and get into new areas as time goes on.
What I like about AAR is that they're very local. They're a local company. You can pick up the phone, you can actually speak to them, they can come and talk to you. And last year I got very, very sick and had to be evacuated down to South Africa, down to Johannesburg. And AAR were there for me. They sorted everything out. I was in ICU for over a month. I couldn't speak. I had a trachea. So my husband had to deal with them. And I have to say they were amazing. Absolutely amazing. My expectations, they were far superior than what I had anticipated.
The medical insurance is everywhere are so expensive, and AAR was really very reasonable to start off with, and I think they're still very reasonable for what they offer and what they give you, and the service that they give you. You go to hospital, and somebody from AAR will care and come and see you and bring you a little bunch of flowers and a nice little get well card. That 25 years later is still a lovely touch of AAR.
And I've actually had a total of 10 surgeries, 3 outside AAR and about 7 with AAR. And I'm expecting to have an 11th one because I'm just rushing to see Professor Duok for a breast surgery again. Hopefully it will be successful, and I want to say that AAR has saved my life, and I wish everybody was a member of AAR, because the medical attention is timely, whatever is required is done, everybody is friendly, the staff, the doctors, they're supportive, and I find life really, really easy.
Right from the receptionist, to the nurse, to the doctor, to the person in the lab, to the cleaner who's ensuring that our clinic is absolutely spotless, to the person who's providing us with a cup of tea in between seeing patients, we all make a difference in that patient's life.
Sasa kupelekea wananchi chai, waifurahie, ndio wafanye kazi na bidii, ili wasikaende kwa kioski kuwaste time huko. Tukipata mtu njiani, tunajaribu kumsaidia, tujue shida yake ni nini. Ile kama tunaweza kuitatua, tunajaribu kumsaidia. Hiyo makesi zingine tutajua baadaye kama tutajaribu kuokoa yeye. Kama ni mambo ya kama ni memba, tutamlipia hata ona pili yake. Kama si memba, mwenye atalipa baadaye pili, ama tutajaribu kumlipia pili baadaye. Kama ule mtu ajiwezi kabisa, ndivyo tunafanya kazi AAR.
We all need a place of security, an anchor to keep us together, something to keep us from moving on, feeling and breathing. Let's find it in the biggest places. Let's find it in the smallest places. We'll move together. We'll move together. We'll feel together from the smallest things. From the smallest things.
Healthcare is an absolutely critical element of whether or not people are able to be economically active to get themselves out of poverty. And so we need to find solutions to make healthcare more affordable to ordinary people.
The corporate employers put everybody on cover, so you end up in a scenario where even the messenger or the driver in a company, who you could say pretty much could not have afforded it or could not have got access to this kind of thing, is actually on cover.
We'd all like to see AAR with both a commercial and a social dimension, you know, but it's very difficult. This is a money-making company. It's a private company. It's got shareholders in it who put money in or have put time in, who've put in expertise and who want to see something in return. So trying to mix that with a social dimension is very difficult.
The community has allowed you to do business. You are making some little money. Without them, you would not have that opportunity. And therefore, you owe it to them to give back some part of the money you have made.
We were trying to reach out to people who do not have access to good health care. So we go into children's homes and you offer a free medical camp for a day or two, where at least if you get people into the program screened, we treat the acute illnesses that we can, and we're able to offer referral services for people who need further follow-up and refer them to the appropriate specialists. And that's something that we plan to continue.
The dawn of 2008 brought with it chaos and devastation to many parts of Kenya. AAR were quick to act and set up the first clinics in Jamhuri Park to cater for the thousands of displaced Kenyans. AAR then set up clinics in Nakuru and Molo, while also facilitating access to medical services in other afflicted areas. The AAR team in Nairobi worked around the clock, dispatching ambulances to conflict-ridden areas. AAR endeavours to continue to provide social and medical services in all aspects of East African life. The AAR Beckman Trust was founded as a non-profit organisation with the aim of advancing AAR's social responsibility projects.
It's been set up by Marika Beckman to promote healthcare issues, and particularly to marry them with the environment. So promote healthy living, promote managing the environment, and so on, to mitigate against disease and to try and spread the, if you like, the green revolution.
Health is always very closely associated with the environment. Depending on the environment you're living in, impacts on your health. The mamas, the other women do that.
Ore kulo keek ouni naa kibelekeny emurua toonkoitoi are. Kwanza ninye ore hewa naa keaku kisidai pii. Ore enkijape naaku ekiwoko naa keaku sidai. Ore enkae naa ekitum sii enchan. Neeku ore taata enakop ang keaku mitoki aaku olameyu. Ntomonok naatolikioki nemelikinoto doi ina. Ore ntomonok naihusika tenewueji naa nera 500 na tenewueji ake openy era 500 naa ninche naaponu aasisho naa ninche naaponu aun kulo keek.
From little things, big things grow. From little things, big things grow.
So I think before we even talk about the curative side, let's talk about the hygiene, the drainage, good food, having good vegetables around, and people having kitchen gardens, and people having a balanced diet. This is really basic issue of health.
It doesn't cost a lot to have a healthy diet. Yeah, in our country, we're lucky to have fruits and vegetables accessible and in season throughout the year. And if you go to the markets, not the supermarkets, but the smaller markets, you can get them at a very affordable price. And basically, we need to get our children moving. We're having teenagers who have diabetes. We have so many people suffering from obesity. We're having people suffering heart attacks at younger and younger ages, and we're seeing them even within our own clinics. And this is all a factor of the kind of lifestyles that we're living.
In fact, somebody said at one time that the future doctor will not be a medical doctor. They will be nutritionists. If there is number one essential commodity for a human being, then it is health. We don't always put it in the forefront. We think sometimes the insurance for the cars is much more important. People pay 5 to 10% the value of their car, but they won't pay that for their health.
My dream for AAR is that East Africans can enjoy quality, accessible healthcare. I'd like to know that every single person, even in our smallest villages, can walk into an AAR clinic and receive quality healthcare. That our children will inherit a healthcare system that caters to the needs of the wealthy and the poor and all people in between throughout East Africa.
Remember that
In the 25 years that we've been in this business, one of our most important assets, other than our brand, which is very, very strong indeed, is the amount of knowledge and experience that we have put under our belt, not just with our members of staff, many of who have been with us for many, many, many years, but also with the volumes of information we have on diseases, disease patterns, expenses related to those diseases. We can tell you who are the good doctors, who are the bad doctors, who are the cooperative doctors, who are the honest doctors. We can tell you which are the hospitals that give what. In other words, we have a huge bank of knowledge and information and experience in this marketplace that I think will stand us in exceptionally good stead as we go into the next 25 years of our growth and development.
From little things, big things grow. From little things, big things grow. We all need a place of security, an anchor to keep us together, something to keep us from moving on.